Jujube has been used to alleviate stress, reduce inflammation, and enhance the immune health for centuries in traditional Chinese medicine. It's a fruit-bearing plant, and it was first domesticated in South Asia around 9000 BC. It's known by more than 40 names around the world, one being the red date or the Chinese date. Traditionally, it's been used in Chinese medicine, and it's still used today to treat digestive disorders, high blood pressure, inflammation, fever, insomnia, and skin infections. More recently, it's been used in the food industry as a food additive and a flavoring. Jujube is a natural source of active compounds like flavonoids and triterpenoids. One of the flavonoids is apigenin, and this has anti-cancer and anti-inflammatory activity. It has isovitexin, and this has antioxidant and anti-inflammatory properties. It has puerin, which is a glycoside with anti-aging properties, and spinosyn, a glycoside with sedative properties. Of the triterpenoids, there's olenolic acid, and this has potential antiviral and anti-tumor properties. Ursolic acid with anti-inflammatory, liver protective and anti-tumor activity, and pamolic acid with anti-inflammatory and anti-cancer potential. There's also sanjoinin A, an alkaloid with anti-anxiety effects, oleic acid, a fatty acid abundant in olive oil that promotes heart health, and zispin, a component that's unique to the jujube leaves, and this blocks the human taste receptor for sweetness. It also contains vitamin B1, B2, B3, B6, vitamin A, C, E, beta-carotene, magnesium, phosphorus, potassium, sodium, and zinc. Some of its benefits: it may lower blood cholesterol, thus helping to prevent heart disease. It might improve blood sugar control, improve sleep quality, improve digestive health, improve anxiety and depression, help to remove heavy metals from breast milk, and the bark has a potential use in drug delivery systems. Jujube fruit powder 3 times a day for 1 month decreased the total cholesterol and the bad LDL cholesterol in a clinical trial on 70 obese patients with high blood fat levels. It may reduce the risk of heart disease by preventing arterial hardening. In another trial on 116 people with type 2 diabetes, a balanced diet in combination with the Jujube infusion before a meal for 12 weeks lowered the triglycerides, total cholesterol, and the bad LDL cholesterol. Similarly, it increased the level of good HDL cholesterol in diabetic and insulin-resistant mice. In a clinical trial on 11 healthy people, the dried jujube fruit reduced the blood sugar spikes after meals, especially when it was combined with almonds. In another trial on 116 people with type 2 diabetes, a balanced diet combined with a jujube infusion before the meal for 3 months reduced a marker of poor blood sugar control, the glycosylated hemoglobin. Jujube carbohydrates lowered the fasting blood sugar and insulin levels in mice and rats with diabetes or who were fed a high fructose diet. A herbal tea with the jujube fruit, astragalus root, and angelica, consumed every day for 4 weeks, improved the sleep quality, and it reduced fatigue in a clinical trial on 20 people. Sun Zhao Ren Tang is a concoction, and it contains jujube, and it's used in traditional Chinese medicine to treat insomnia. In a clinical trial on 90 people, this remedy improved the sleep quality and the efficacy. It was also effective in combination with another traditional Chinese medicine, in another trial on 119 people with insomnia and anxiety. The jujube produced a calming sedative effect in mice at higher doses. Spinosyn found in the jujube decreased the time to fall asleep, and it increased the sleep length time in mice. The jujubicide in the jujube fruit increased the duration of the REM sleep in rats also. In a clinical trial on 37 chronically constipated people, the jujube extract reduced constipation and it increased the quality of life. The leaf extract protected against castor oil-induced diarrhea, and alcohol-induced stomach ulcers. It also shortened the digestion time, and it protected against oxidative stress and excess gut ammonia in rodents. Two traditional formulas reduced anxiety and sleep disturbances in a clinical trial on 119 people when taken in combination daily for 4 weeks. The jujube seed significantly reduced anxiety in mice. The component sangenine A was as effective as the anti-anxiety medication Valium. The jujube seed also contains saponins like jubicide A and B, and these increase the GABA receptor activity. Depression and anxiety are linked to low GABA levels. Inflammation might be involved in the development and the progression of depression, and a concoction with jujube, wheat, hawthorn and lily decreased depressive symptoms and the levels of a pro-inflammatory cytokine, TNF-alpha, in mice. In a clinical trial on 40 women who'd recently given birth, those who ate the fresh jujube fruit every day had lower concentrations of toxic heavy metals like lead and cadmium in their breast milk. The jujube bark was successfully tested in adhesive discs to deliver drugs to patients with mouth disease in both a gelatin layer and a small trial on 10 healthy volunteers. Rats who were given the jujube extract before alcohol had improved spatial memory and learning capacity. Jujube extract increased nerve cell growth and development in the dentate gyrus of mice. Estrogen-deficient rats who were treated with jujube had improved learning and memory function, and the jujube also increased estrogen levels in the blood and acetylcholine levels in the brain. Jujube extract protected against seizures. It improved brain function and it reduced oxidative stress in epileptic rats. Glutamate is an important excitatory neurotransmitter in the brain, and too much glutamate can cause brain damage and conditions like stroke, epilepsy, or Parkinson's. Jubicide A is a compound in the jujube, and this reduced the glutamate levels. Amyloid beta plaque is involved in the development of Alzheimer's disease, and Zispus macronta, a close relative to the jujube, has some of the same active compounds, and this reduced the toxic effects of the amyloid beta plaque in human brain cells. Astrocytes are star-shaped cells and they're found in the brain, and these protect the neurons by releasing growth factors and controlling antioxidant enzyme levels, and the jujube improved the function in cell-based studies. Jujube is rich in vitamin C, and this vitamin supports immune function and it prevents infections by increasing the production of beneficial inflammatory cytokines. Butylinic acid is found in the jujube, and this protected the immune cells from inflammation that was caused by the anti-cancer drug doxorubicin. Jujube has traditionally been used to treat eczema. In a study in mice, the jujube essential oil at 1% and 10% reduced skin inflammation. The jujube essential oil at 1% applied to the shaved skin increased the number of hair follicles and hair length in mice. Jujube extract had antibacterial activity against potentially infectious bacteria like methicillin-resistant Staphylococcus aureus, MRSA, and E. coli in test tubes. It was also slightly toxic to many species of fungi, including Candida albicans. Betulinic acid from the jujube prevented the replication and the development of the HIV virus. Jubicide B kills stomach cancer cells in test tubes and it suppressed stomach cancer tumor growth in mice. The betulinic acid and the triterpenoids were found to kill brain cancer cells in mice with brain tumors and multiple cancer types in cell-based studies. The ursolic acid was found to protect against breast, colon, and liver cancer cells by triggering cell death, as was seen in animal and cell-based studies. Jujube is generally safe when it's ingested in normal food doses. No adverse effects have been reported in the few clinical trials carried out so far. Palmonic acid is a compound found in the jujube, and this can increase the risk of fatty liver disease based on the results of a cell-based study. Jujube extract at 100 mg per kg increased the effects of the anti-epileptic drugs in rats. The doses used in clinical trials for testing the Jujube for cholesterol was 5 grams of Jujube powder 3 times a day. For blood sugar control, 84 grams of dried fruit per serving. For constipation, 20 to 40 drops of extract per day. Or for heavy metal removal from breast milk, 15 grams of Jujube fruit per day. Many users report taking Jujube to reduce anxiety or to improve memory. Some customers claim it curbed their anxiety and improved their sleep quality. For more on herbs, supplements and natural treatment plans, check out my website.